Good afternoon. My name is Dana Goldman, and I have the dubious pleasure to self-introduce myself. So I am the director of the Schaeffer Center for Health Policy and Economics, and I'm very pleased that we could co-host this event because this is a topic of enormous salience, as all of you know. My personal area of research is not end-of-life care, but they said we need someone to spend 10 minutes while the breakout session organizers get their thoughts in order. And they asked me to do stand-up. And I said, you know what, I think I'll just go with some slides. So what I'd like to talk about is something, and actually Carl Lorenz brought this up earlier, whether we're making progress over 2 decades, and from my perspective as a health economist, this will be at 30,000 feet, but I think it's instructive. And the first question is, how are the resources devoted to end-of-life care actually changing? And we did some analysis using the Medicare population, and we looked at people over the last 20 years, 1992 to 2012, almost 20 years. The data aren't out more recently. And we looked at the people who died in a given year, and we asked how many of them had any inpatient stay. And you can see it was about 68% in 1992, and it's gone down steadily over time. In addition, you can ask how many people had a hospice stay, and that hospice stay was not associated with inpatient stay, because I heard from the earlier discussion there is an issue of more resource use of everything. And you can see we went from about 5% to 23%. And so if you look at another way to look at this, and I think you've seen it, is that 41% of the people who die are receiving, 46% now are receiving hospice care. And, you know, that translates into dollars. We're spending about $10 billion. Which is actually, in my view, a very small number when you think of how much we're paying in the Medicare program. It's almost, one might argue it may be inadequate, but that's certainly an issue. And another statistic that comes up a lot is how much is being spent at the end of life and issues like that, and what fraction. One way to see this is just to say, you know, we worry about Medicare and its solvency. How much of our annual Medicare dollars are being spent on people who ultimately die in that year? And you can see that it was about 18% in 1992, and it's actually fallen to 11%. Now, one reason it might be falling is because people are living longer, and we have a lot of healthy people, and so there are some demographics tied up in this. But I think, you know, when we cite statistics, this is actually good news. And the other issue, of course, was, you know, whether people are using these services differently. And we did a little bit of analysis, what we could, knowing I only had 10 minutes. And what you see here is that when you look at the white population and the black population, actually the patterns of care, at least in resource use, look very similar. But when you look at the Hispanic population, you see more use of inpatient and less use of hospice. Now, I don't know the reasons for this. One reason may actually have to do with the family structure. We know Hispanics have more children at home, for example, and there may be other alternatives. But I think it's very interesting is what we do know is that Medicare is increasingly becoming Latino population. And so as we think about trends and the cultural differences, it's important to understand the distinctions. Now, of course, an important issue is whether people are actually expressing their preferences more. And we have a data set at the center called the Health and Retirement Study, and it's been ongoing since 1992, and they've been asking questions of people, proxy interviews for those who died, since 2002. And so we can look a little bit at this, and what we see is that whether the decedent provided written instructions has actually gone up over this 12-year period from about 39% to 50%. Now, so about half of the people who died had written instructions by these data. And so then we can ask, what are the written instructions? And they asked the proxy respondents to articulate what were in those instructions. And so it looks like there's been a trend that people who are saying in their written instructions to limit care in certain situations is on the rise. And people who are saying to withhold any treatment is also on the rise. And then finally, it turns out, and I think this one is particularly important as well, they asked whether people had in their written instructions to provide all care possible to prolong life. And you see that that went from 0.5% to 3.8%. So on a relative basis, it actually is the one that is expanding most rapidly. And so there are 2 points that I want to make about this. The first is, and I said this earlier in my question, it's very heterogeneous what people want. And so we should not be monolithic in the way we think about it. The second part of this is this does not add up to 50%, and they don't make sense together. And what that means is the proxy respondents in our survey were probably pretty confused about what the written instructions said. And so take all of this with a grain of salt, and maybe we will end up doing a deep dive into these data. But the point is that this is all very confusing. And they also asked, did the instructions apply in the decedent situation? And only 42% of the cases did they do it. So we've got written instructions. The family member who knows them best doesn't understand them. They don't always apply. Maybe that was obvious to everyone, but for me it was rather insightful. And then finally they said, was the patient involved in the care decision? And it turns out it's going up, which I guess is progress, but it's only about 1/3 of the time, which for me is a very scary thing. But, again, circumstances vary in the ability of people to articulate what they want at the time of the care obviously varies quite a bit. So then you can ask, is the current cohort prepared? We're seeing some progress. And, if you look at age 65 to 74 and you ask, have people, these are not among people who died, these are among the living. Have they discussed care with a caregiver? Do they have power of attorney? Do they have a living will? Do they have living will that limits care? The rates here go from 70 down to 40, 45, 43. And so, 65 to 74 is clearly an age where people are still vivacious and have a lot of potential, but it's also an age where we should be making these decisions. And I don't know if the answer is driver's licenses or what, but you can see, though, that the gradient goes up quite a bit with age. And so older Americans, I think, are being confronted with these decisions and are making these decisions. But the question is, how do we get people to do it earlier in life? And you heard some discussion about that. And finally, I think a lot of us would like to believe that, talking to the physician is the answer. Well, when you ask the physicians, 68% of them are reporting that they've not had any training to discuss end-of-life care. So we're encouraging people to talk to people who aren't trained to deal with it. And as a policy matter, I'm not sure that's optimal. So let me conclude, because again, I'm just the warm-up. Thank you. Yeah, I appreciate that. The trends in resources are promising. We're spending a smaller share of Medicare dollars, and it appears that people who are dying are using less inpatient care, which is a key to limiting costs. Written instructions are proliferating, but they don't always make sense. There's a lot of heterogeneity in preferences, and basically patients remain uninvolved in their advanced care. And I wish you all good luck with that optimistic news. So, With that, it's my honor to introduce Anna Gorman, who's going to be moderating the panel discussion. Anna is a senior correspondent at Kaiser Health News, a nonprofit health news service and a program of the Kaiser Family Foundation, and has really been quite in the vanguard about improving our understanding of health and reporting health news. She writes about health for media outlets nationwide, including CNN, NPR, The Washington Post, and The Atlantic. She spent nearly 15 years as a reporter at the LA Times, and she's based in Los Angeles. We're hoping she'll come by the center. She covered health, immigration, and the Mexican border, and she was on a team that won a Pulitzer Prize for coverage of the Southern California wildfires. And I could go on, but I think I'll let her take over. Thank you.